on my clock.
All right, let me double check, but I think we're good to go. Hold on. All right. All right.
I feel like I look like Hillary Clinton.
I
I got that haircut. I'm like, yeah, it's like the weird haircut. So I chopped off my hair. You didn't notice? Yeah.
did actually,
Yeah,
sure.
sure.
I got some,
Good to go.
yeah.
We're going.
Oh, good.
Good
We're
morning.
doing
Good
great.
morning.
Yeah, wow.
Today is just.
Well, you know what? I feel like
I
I
don't
woke up
even
in
know.
America. I feel like I woke up in an America this morning that is as close to an America that I don't recognize as I hope I ever do.
Me too.
And listen,
too.
if we
Just
have one thing that's the
disgusting.
foundation
Today, like
of
I know
the
it's the
country,
green room, but today, I'm sorry, gloves.
no,
to
we're going to
watch
get to
because
chronic pain.
we
And
will,
in
we
some ways,
will,
this is
but-
acute pain. Listen, we all have to listen.
it's nauseating.
The peaceful transfer of power and the respect of the vote.
Is part of what this foundation of this country is.
It is what the
It
foundation of the
is.
country is. And we have to remember that democracy is nothing but an experiment, right?
It is.
An experiment that we have successfully navigated through a lot of
A lot of
challenges.
We have, but to actually jeopardize this republic with this man.
Listen, ballots are
coming out-
ballots. And until somebody can
ballots
show
are
me
ballots.
that there is massive voter fraud going on, and no one has ever been able to show that, not in the 2016 election and not in what's leading up to today. But listen, here's my point. And listen, I have a lot of Republican friends,
I do
and I
too.
know you do too, Ruta, and I know
I
some
do.
of them are watching.
And to the legislators.
I hope, listen, State Senator Gruder's a friend of ours, okay, who's
yep.
been to the clinic, and
Greg Stubbe,
and Greg Stubbe as
a
well.
constitutionalist.
James Buchanan, okay, our local
Vern
representatives,
Buchanan,
I
well, he's still
believe,
there.
need to make a statement today,
They do.
whether or not
Defend our constitution.
defend my vote, defend our votes.
republic,
Listen,
our
guys,
country. This is
work as hard as
outrageous.
we're gonna work. You work
We're
as hard as
today.
we're gonna work to try to get as many votes for your candidate
We
as
are.
you can.
Exactly, that's their job.
And if he has more votes,
That other person
all right,
wins.
then he will win. But if you
Exactly.
don't, you can't put this
challenges.
country through the pain. And
Yeah.
listen, if there's 8 Supreme Court justices, can you imagine
Oh.
the scenario
By the way,
where the
I have
chief
my
I
call.
love it.
I have my Ruth Bader Ginsburg.
and RIP, you know, Ruth Bader
Okay,
Ginsburg, you know,
RPG,
seriously.
RBG, honestly.
But there's so much going on in the country right now. But my point is, listen, if we
God
can't
rest her soul.
respect our vote, then what else do we have?
Oh.
So work hard. And if your candidate gets more, but you can't put the country through a protracted, legal type of battle. Right now, we're too divided. We don't need that.
But beyond a legal battle, right now, I swear, I woke up and I felt like I'm in communist Russia. I really did. I'm like, okay, we're gonna have fixed elections. Whatever the outcome is, they're not gonna accept it. It's like Putin does every time.
Well, it was
with
a
his votes. Now we
peaceful-
have Trump doing it.
A
Are you
peaceful
kidding me?
transition.
He can't even say
No,
oh.
no.
Okay,
no.
sorry,
All right,
we had to
chronic
get
pain.
it out. And this is causing chronic pain.
It is. So, you know, when you talk about pain, of course, in a cannabis clinic, it's really important, Ruta, because
It is.
believe it or not, we're not even allowed to advertise that we treat
Treat chronic
chronic pain in the cannabis clinic. Pretty widely ignored if you look at people's pamphlets or brochures, but we're always very careful with our wording. The reason for that is that Senator Rob Bradley, right, who still is in the Senate, he was in charge of the whole committee at that time that brought the constitutional amendment to the legislative session for more rules making, right?
Of course.
And there's an asterisk next to chronic pain,
Mhm.
right? So you have your qualifying
Like
conditions,
that.
then chronic pain with an asterisk. And what that asterisk means, I can't even say the word right. And what that asterisk means, everybody, is that the chronic pain is supposed to be coming from one of the other qualifying conditions that's not currently active. So it's been a trick, a trap. The pain management world wanted it worded that way because they
course,
want to
they wanna
maintain
maintain
their handle on the treatment of chronic pain.
Yeah.
And listen, people, we know how to handle that to the extent that, in my personal opinion, everybody with chronic pain in their life has some degree of PTSD. If they're on narcotics, they want to take less. Typically, they don't sleep well. They have anxiety about their pain. They have depression about their
course.
pain. So the advocate physician in Florida has a well-worded law, quite frankly, that allows us to help patients with pain. Now listen, Ruta, people talk about no research, okay,
all the time.
in the medical cannabis world. Listen, I was watching a seminar from Peru, everybody, the other night, okay, and as you know, I like to make the lemonade out of lemons, so to speak. One of the only good things about COVID is now it's tuned me into all these webinars that are around the world, quite frankly, and the Spanish translation. Although the slides are still in Spanish. It's cool because it's almost like you can kind of learn the language, so to speak.
Sure.
When there's a slide up there and you're getting the translation. I know.
Mm.
But the point is, listen, there's research elsewhere. The World Pain Council, actually, I think is exactly what the name is, which is from around the world. Doctors came out with an endorsement of further study and research of medical cannabis for pain. So there is recognition. We just don't have the US research, right, that everybody wants. And I respect that. By the way, if people have questions, I know you always.
Yeah, please. If you have any questions, please ask. And
because listen, chronic pain is the leading reason why people do come to the cannabis clinic. I mean, that's just national stats.
It really, and it's, I think until you have chronic pain, I took out my knee, and talk about pain. It's until you have it, you don't actually empathize with people, because I'm like, oh, how bad can it be? It can be really bad. It's like, okay, I'm on some painkillers right now, but I'm like, but still, if you have this chronically, I can't even imagine. Honestly, it's very depressing because it debilitates you. You can't move around. It becomes depressing. So for anyone who has questions about medical cannabis and pain, please ask them now.
So how cannabis works for pain actually is interesting. And there's a whole receptor system that those of you who have been in the green room before, I know have heard the term, the endocannabinoid system, right? So that's the group of receptors in the body that respond to cannabis. Pain, if you've ever heard of endorphins, for example, right? So runner's high and this and that, right? The opioid system affects the endorphin, so there's a whole chemistry to it that, I don't like to get overly sophisticated in the green room. But the point is there's actually some cross reactivity between the two systems, so that medical cannabis aids in the opiates that patients are actually taking. But a lot of patients actually, of course, want to get off the opiates so they can supplant and replace.
They're like, please get us off the opioids.
And we actually have a pretty interesting philosophy about it here in the clinic that may be different from some others. And I want to give some good news to everybody that's watching as well. To the extent of how the atmosphere has changed and the landscape has changed over the past 3.5, 4 years since we've opened. Mm-hmm. In the beginning, we had pain management doctors that really didn't understand what we did. So they would have their patients on chronic narcotics and, debilitated patients who for years have been on certain medications. And then they would come into the cannabis clinic to try to reduce those medications. Mm-hmm. And somehow a lot of those pain management guys, not everyone, but a lot of them would feel that that patient must be partying on their Percocet, so to speak, right? Yeah. So if they're going into the cannabis clinic, they're looking for an addition to the party or something. Meanwhile, each and every patient is telling me that they can't wait to take less and get off the narcotics. The constipation, the addiction to it. Listen, if you're on a narcotic every day and you don't take it for a day, you know it. Well, you sweat, you have intestinal issues, and typically you're not going to go the second or third day without taking those pills again.
No, and this is something, again, with the legislators of the United States and here on a state level, everybody talks about the opioid crisis, opioid crisis, opioid crisis. Here you have a natural alternative, and they're trying to still make barriers to entry to obtain it. And I find that so disheartening.
We couldn't even get it out of House committee last year in the state of Florida. And that's in spite of 2 doctors, being in the House who should be speaking for it and unfortunately are still speaking against it. So once again, I invite Representative Pigman and Representative Mazzullo into the clinic for education anytime. Anytime.
And they should, as a physician, as a legislator, why don't you go speak to the professionals who do it every day rather than have this prohibitionist mentality? Yesterday I was thinking about not just cannabis, I was just thinking about everything with Trump, with everything. And
it's a maelstrom is what it is. It just is.
Otherwise known as a cluster of something.
Yeah.
but it really is. And I'm like, why is it that we want to go back to horse and buggy times? Why is it that even with with RBG gone, I feel like we're gonna go back in time and rather than progress in a natural progression with a natural herb, we're still going to the prohibitionist side. And I just don't understand it. And for people who have pain, they are looking for something that's not addictive, that's not gonna have them hooked for life, that makes them function. How many vets come in with PTSD and say, oh my God, they have us on so many opiates, I can't even think anymore. And they're
sure.
looking for relief. So
Well, they are, and they're looking for
are.
less of a pharma burden. And what I was
Yes.
leading to is the sense that our philosophy here in the clinic is interesting. If I have a patient coming in on a certain burden of medications, my first goal is for that patient to feel better, right? And my personal philosophy is that with almost each and every patient coming in wanting the three things that we know, feel the best they can in the most natural way they can, and to be legal in doing so, that middle section almost always includes reduction of their pharma meds. So we know that they're best doing it on their own with our best advice on the teaching of how to integrate cannabis, how to integrate cannabis safely. Now, here's the safety issue, everybody, that is of utmost importance. The receptor systems of the opioids, okay, and the narcotics, alcohol, benzos as well, are the mu receptors, not the CB receptors. So you can never die from a cannabis overdose, and there's no additional respiratory suppression or otherwise blood pressure, heart effects in general from cannabis with other medications.
Yeah, which is important.
So you can
know,
add
so
cannabis to the
don't know
others
that.
very safely, right?
That's a
So what
great
we
point.
teach is that integrate cannabis into your regimen,
Mhm.
learn how to use it, and then slowly start to reduce your other medicines. Listen, I'm just a commonsensical ER guy. So I just go by the KISS philosophy, keep it simple, stupid, right? So, which is probably a good philosophy for
everything,
politics
for
these
life. Oh
days,
God,
too.
for just all of life.
And listen, maybe we have some other viewers and maybe, you know, State Senator Gruters and maybe, you know, Congressman Stubbe, maybe those guys are around right now. Listen, I think a statement today would be great. Just tell us that you're going to respect the votes of the people of Florida. That's
Ballots
what we
matter.
want. Ballots matter.
Ballots matter.
So the point is we give our patient that freedom, okay, to do it on their own. So I'm just a commonsensical, keep it simple, stupid guy. I got off on a tangent, which I knew I
We
would.
always-
But the point is, pick out one medicine at a time. Don't work on two at a time and stop nothing abruptly, right? So you slowly can reduce your burden of other medicines. It's so much fun to see. It's so fascinating. You know, it's almost like, Ruta, we laugh about it in the clinic sometimes. We don't want to yada yada
no,
our patient's success,
no.
but we hear it
have-
every
we have
time.
it
We hear
every
it so
day,
often.
Every day.
So we want to give each patient, you know, ring the bell, so to speak, on the
Yeah, we should have
success
a,
that
like-
they have. Well, that's the cancer world, but we feel like we have it, you know, here
Yesterday we
in
had a
the
rough
clinic
day
as
with
well.
cancer patients.
You know what, though? One of the beauties of this particular clinic, and, you know, listen, I'm going to follow my Jewish mother's philosophy, only say good about your own, never bad about anybody else's. But seriously, we're here every day, all day. And we had a cancer patient walk in yesterday, just wanting information with her son. And we got her into the program that day because we can. We have the greatest staff in the world. You met him last week. And we're very malleable here to that extent.
So they were so grateful. I mean, they were looking for any help.
And the beauty of it, everybody, listen, there's no 90-day waiting period anymore.
No,
Hey, listen,
fantastic. And good kudos to the state on that.
no doubt. You can imagine in the early days, there was a 90-day waiting period where a patient like that would come in and we could only meet and greet. Well, some did.
I know.
And that's those are Patty's early tears.
Oh my God.
You know, in the
I
practice.
mean, honestly, this practice, it does bring you to tears on a lot of times.
The ups and the downs.
There's ups and downs.
But the good news is a patient like her, well, within 2 weeks now, and once again, kudos to the state and the OMU, get her information back via email, not the card for a little bit of time, but all they need is that email recognition. So you can get into the dispensary within 2 weeks of coming into the clinic, and for pain as well. So listen, we're not allowed to advertise for chronic pain. But the point is, it is one of the foremost reasons why people walk into the cannabis clinic. So there's an understanding of one, make sure you call your clinic, okay, to talk to the staff there and find out the philosophy of the clinician, how he handles chronic pain. Believe it or not, the OMU has kicked charts back to clinics that have listed chronic pain. So you need to know how to do it with integrity, honesty, education, and respect, right? But we see fantastic results. And listen, every cannabis clinician wants the same thing, Ruta. We all want research on this. Every single one of us.
Everybody does.
And we know what needs to happen for that. We need to get rid of
Schedule 1.
federal Schedule 1 designation, right? And once again, that's just one of the issues that's coming up, into the election season, to that extent.
And again,
So,
if anyone who's suffering from chronic pain, if you're listening, if you have any questions, please ask. I know that we have a lot of people listening on YouTube now and through Instagram, so you're actually national. So even if you're out in Ohio or you're in Boston.
2020 has been rough. Tom Seaver died. We just lost Gail Sayers too.
Yeah.
So how chronic pain comes down, everybody, is listen, THC, as you know from past green rooms, is the main actor in cannabis for pain, for nausea, for really pretty much everything. CBD and the other cannabinoids being so important. That's what's so great about medical cannabis, to the extent that you can be somebody who's never used it, and we can use a higher concentration of the CBD, which is not psychoactive or mentally affecting, which of course our adults try to avoid.
And I wanted to ask you, I'm sure people's questions, because I'm sure you have them, is if I take something as a replacement for the opioids that I'm on or for the chronic pain, will it mentally affect me in a certain way? And I'm sure people have.
Listen, opioids are opioids. So, I get fascinated by how people function on those, on a day, and benzodiazepines, Ativan and Xanax and things of that nature. So, cannabis similarly so, there is a tolerance. That's why Willie Nelson is Willie Nelson, and that's just with THC. But more importantly is the ability to take the non-intoxicating cannabinoids, right, and make them a prominent part of the medication. And then the THC can be at a much lower level, so it really doesn't give anybody the negative mental effects that they
and I think a lot of people probably don't know that you can adjust amounts.
Absolutely, of course.
And there's although there's not clinical dosing per se, but you can adjust.
Well, there's not. Listen, you may take a product that's a CBD and the others and a THC combination during the day to 1-to-1 ratio, and then at night for sleep, more of a THC-based combination. Also very important, everybody, it's not just the inhalation routes of cannabis, right? It's the tincture oils. Now we have edibles in Florida, which are your cookies and your candies and your brownies, things of that nature. They've always been in Florida, but more in pill form, interestingly enough. But patches, everybody, and creams, believe it or not. Ruta, because we've talked about this. The creams have been fascinating to me. 2 years ago, the creams weren't really on the market. The MMTCs hadn't really produced them, and the patients weren't using them. So I kind of mentioned it maybe in passing, but now each and every patient gets an extensive discussion about those other routes, because we find people with significant arthritic problems local to the hands, the knees, knee injuries.
Knee injury.
Point is, you can use a topical cream and get incredible results, which I like to call the outside in route, so to speak, versus the inside out route. So that's the beautiful thing about cannabis, is that you can mix up that witch's brew, so to speak, of safety. We actually have a phrase for it, because the safety of cannabis is 100%. Listen, no one's going to find the strain either, at least as far as I know, Ruta, that's going to make them run down the street naked as a jaybird, over cannabis. It just doesn't go that way.
Well, Matthew McConaughey played the boss.
Yeah, but you get your misconceptions. But the point is, it's very controllable by patients, and we know it's ultimately safe because no one's going to stop breathing. So safety is here. And then we say control by education is where you get your relief. And we never promise 100% of relief to anybody, because that's not fair.
It's not.
It's like being a snake oil salesman, especially if you have 3 failed back fusions, or, God forbid, you're in a wheelchair with paraplegia and spasm and this and that. But there seems to be something about cannabis that just uniquely helps those patients deal with their pain in a different place and in a better manner. We're told this every day. So we get anecdotal stories all the time, and we do want the research. But the best we have right now is what our patients tell us, and we're going to continue to do what we do. Michelle Weiner, on the other hand, down in Miami, good friend of mine, is doing research here in Florida in her pain management clinic on cannabis, and many other people are starting to do this research, but we still need to get rid of Schedule 1 designation.
We do.
That's what has to
so
happen.
we're going to be wrapping up with a couple public service announcements. One is, if you are interested in hearing or meeting any of our staff, we're going to be on marketing in Maine at the Hyatt Regency next Wednesday. So please come out. We'll have a table set up there under Compassionate Cannabis Clinic. If you have questions, staff will be there. Dr. Barry should be there. there. I'll be there. Other staff members will be there. So come join us there. Tonight we are, although we're in the green room, there is some podcasts going out for different candidates. So tune in, see who's out there who you may want to vote for. A lot of them are doing active fundraising right now. We're coming into the last 60 days, so it's a push. We have only a small window left for you if you haven't registered to vote. We're talking about a week. So please, if you haven't registered to vote, we always say this is the election of a lifetime. We're not kidding. This is going to be a crucial election in our lifetime. I am so scared as a female with the death of RBG that life as I know it as a woman, my rights are maybe in question. In my lifetime, these women have fought for these rights. In the 60s, I was born in the late 60s. These women have fought for my rights and I want to defend them. And please vote for who's going to represent you and who's going to take care of us and who's going to believe in ballots. And
it's a referendum on the country itself. To me, Ruta,
it's such a scary time. And I hope that the younger generation truly appreciates the Ruth Bader Ginsburg's and the fights that women and the shoulders that I've gone on.
I think people may not recognize what we have here in America.
They don't.
The freedom, the freedom. Let freedom ring,
oh
you know,
God.
and that's voting, everybody.
Voting
and please respect our votes. And let's see some statements today. Listen, there was a
Statements, please.
Republican Congressman, Steve Stivers, actually from Ohio, that was the first representative to come out this morning and repudiate yesterday's statements, and of course Mitt Romney as well. Let's hear more today.
Defend our republic for a peaceful transition.
Work for your guy. We're going to work for our guy, but let's make these votes count.
And we'll see you next week. And thank you for tuning in, everyone.